Welcome to everybody, and thanks for the organizers of the Unconference. And we've been hearing that it has been a success so far. So congratulations, and it's a nice initiative. And okay, so let's perhaps introduce ourselves first to those that do not know us yet. I received a nice challenge from, it's an idea of Marlou, who said, maybe we should describe ourselves in one sentence, but not ourselves, somebody else. So I have the honor to introduce to you Marlou. And if I have to describe Marlou, just raise your hand. Yes, thank you. If I have to describe Marlou in one sentence, and she hasn't heard it yet, so the sentence is, Marlou is the caring, proud mother of the constellation with a worldwide view, as if she were an astronaut who has seen the blue marble from outer space.
Ooh.
Yes.
Thank you, Jan.
You know the overview effect of, if you see the overview, it has an effect on your cognitive things. That's why I included it. Yes. Okay. Nice. So that's Marlou.
Yeah. And with that, you introduced yourself as a poet, but I'm going to introduce Jean-Louis. So Jean-Louis, I think the man who, when you meet him and people are around him, those people are always laughing. So always with people with smiles around them. Sometimes they are frowning as well, because Jean-Louis can throw in challenges, which is nice, which will happen today as well. So we'll be smiling, laughing, and frowning and be challenged.
Yep.
A great friend.
Now, Jan is someone who knows what appreciation is. I think we met through connection with Ritu in the context of AI, and he knows what appreciation is, and it is expressed in all kinds of soft ways. He is not only a poet, but he is also a poet photographer, which makes him quite a complex and dear friend.
Okay, well, thank you very much. And we see that Manorama has entered the building.
Hi.
Manorama, hi.
Hello,
Where are
Manorama.
you from?
I'm from India. I'm from India.
From India, from the north or the south part of India? Or? Okay, cool. Right, we just started to introduce ourselves as the hosts for this this session of the whole series that is going on in the Unconference. And what we would like to hear from the participants is, with all this COVID-19 going on, how did you experience this as a citizen? The COVID-19 measures that were taken in your country, how did you experience them in your life as a citizen? Who wants to start?
I'm happy to go first, Jan.
Okay. Yes, Michelle.
So for me, it was actually interesting because I was in the UK working during January and February, and of course COVID broke out, and was leaving the UK on what was it, the 1st of March. And we actually at that point didn't know when we arrived back in Australia whether we were going to be sent to Christmas Island, which is was an island they were using to, they moved anybody that was coming back to Australia from China all went there. We weren't quite sure what was happening. It was quite bizarre. We get back into Melbourne and it was like nothing had happened. It was like, you know, business as usual. And then the toilet paper drama hit. I don't know if it was the same in every other country, but toilet paper became like gold. But besides that, besides bizarre things happening in our supermarkets, we've been quite fortunate that we've been spared a lot of what the rest of the world is experiencing with COVID. Although I live just north of Melbourne, and our restrictions had eased. We've actually gone back into tighter restrictions again because we've got a bit of a spike at the moment. But you know,
how did you feel about it as a citizen that these measures were taken? You just sort of like you agreed, you accepted,
absolutely.
Or what was...
Look, I live in the country, so I live in a rural community. So for us, it was really important that there were not rules put in place, but that I think our government was very proactive in what they did, and I know now the longer it goes, the harder it is for people to deal with, and particularly because it's almost like if you haven't got the body count, then there's a big push to ease all the restrictions. Yet I'm a little bit scared of that because I've seen what's happened in other parts of the world. But as a family unit, it's been amazing. Like, I think we've connected so much better than we would normally because there's just been us. You know, a lot of the times we've not been able to have people over and things like that. So I feel like the COVID measures have actually given a whole wave of opportunity and closer connection. So,
okay.
Yeah.
Anybody else who wants to share some experiences? How did you experience as a citizen the COVID-19 measures that were imposed in your country? And I see that there is... Oops.
I may say something if it's okay.
Yes, sure. Go ahead.
It might sound a bit different. To be honest, I was expecting something to happen just yet a way we were living before COVID-19, based on a statement made on 18th of January 2019, a year before COVID-19, by international governing body of our community, which is called Universal House of Justice. They just mentioned about World War I and World War II, League of Nations, and then United Nations that happened, and mentioning something will happen, not clearly, COVID-19, unknown to everybody a year before, is such a unique event or incident that happened to humanity in the whole history. But the point is, we came to kind of situation humanity needed such a thing. So as a citizen, I'm feeling it's like kind of crisis will end up hopefully with minimum suffering to a victory, which makes us to move forward to something very different before COVID-19, and use COVID-19 as indicator. COVID-19 is not the whole problem. COVID-19 is part of the problem. As a citizen, I really would like to get to know, as grassroots involved as world citizens, that we need to move forward beyond the way that we are thinking with different prejudices, national, racial, gender, religious, etc., etc. And which is...
So you hope that it's an opportunity for that to change?
Absolutely. Mindset. Absolutely. And it's just indicator. There are so many other things if not worse, the same, you know, gap between poor and rich, militarism,
Yep.
trillions of dollars for weapons, etc., environment. So we need, and that's why I'm very hopeful that the United Nations recently made a Zoom conference and just provided a paper called Elements Paper. So as a world citizen, as a citizen in UK, I'm quite positive, however painful.
Okay.
Thank you.
Cool. Okay. Can I ask and welcome Harriet Johnson, and there's also Selma from London. I see on the nice profile picture. But let me ask Harriet, how did you experience wherever you're calling from?
Hello, I'm calling from Hull in the north of England, and I've met Michelle before. So hi Michelle. Michelle came all the way from Australia pre-COVID. Remember that time? And did a brilliant session in our city. I work for a community foundation, so we distribute money, and I feel like my personal experience of COVID is like I've not really experienced it because we've been working so hard that it's been driven through my work experience of getting money to community organisations and charities that need it in order to thrive. So I don't think, I mean, I've personally really loved the bubble I've been in. I felt quite safe at home, and I think it's made me realise how privileged I am as a person to have a safe home and a husband that I haven't wanted to kill. And you know, like, I know a lot of people their partners have made, including my parents, have driven each other up the wall. So yeah, it's really weird. Nobody's actually asked me in this type of setting what my experience is, but I think my work has been the main focus. And
the measures that were imposed on you, you took them as that's logical. You took them as this is what we need to do, or did you have some kind of feeling about it?
It's felt like it's been like a drip feed in the UK. You know, I've witnessed in other countries the rapid response by the government. I mean, I'm not a supporter of our government in any shape or form. So following the instructions of someone you don't believe in is a challenge. But my priority was to keep those people who are important to me safe. So I was willing to make those alterations. I think we've been incompetent as a country of how we've responded, but that's because we've been following really poor leadership. So yeah, but I would do it because my priorities are my community and my family. So I would follow those instructions to create that safe space for them.
Yeah. Okay. Anybody else who wants to share how they experienced? Yes, Manorama. I love the name, by the way, Manorama.
Yeah, you pronounced it very rightly.
Is it so? Okay.
Pronounced,
lucky.
Yeah. Actually, I will share a bit of Indian experiences, like when our Prime Minister Modi, he announced lockdown 1 and lockdown 2 abruptly, like people were not very much ready, even though at that moment, like we had the COVID cases around 500, 550, not much, but I think that having a huge population, like having 1.3 billion of the people living in India, I think that was the right kind of decision and right leadership thing that he announced, that otherwise we would have crossed maybe more than 10, 15 lakhs by this time if we would not have contained it then in the beginning. That lockdown 1 and lockdown 2, even though it was a very strategic and very good political decision, but at the same time, like some of our workers, especially India has almost 93% of the population is in unorganized sector. And when it comes to the, labor workforce or those who are migrants, migration is a huge challenge. So the migrants, they were on the way and some of them had to travel almost 100 hundreds of the kilometers to reach their home destination, because lockdown was immediately introduced. And then even though like they had later on like put you know, infrastructure and transportation in yeah, but in the beginning it was a big challenge, but somehow like strategically it was right decision to have lockdown 1 and lockdown 2. Then we also saw like India is per year we have a birth cohort of almost 2.8 crore babies India produces every year. So you can imagine like if it's lockdown, how the mothers, like being a public health professional, I see it from a very different angle. It's not that we don't have the, even though the government had said that we will have the essential care services for the people, but people were so much fear stricken. So India almost in 3 months, like if the lockdown was for almost 3 months, then you can imagine the antenatal care, the intrapartum care, the postnatal care of these females. They're not receiving the kind of, you know, iron folic supplementation, calcium, and how it will impact their health and babies not getting the immunization at the right kind of time. So these were some of the things, even though like the ministry had said that and issued the orders like, that essential services needs to be provided to these females, but people were so much fear stricken that they were not going to the hospitals. So that was one thing.
The fear
and
struck.
So many other changes.
Being fear struck is something we hear in many places, and fear is becoming a driving force for many political and other decisions. And that sort of brings us also to the points that we are going to try to discuss in a particular way today during this session. If we the objectives that we have put for our session today is that we want to offer a moment of reflection on the potential positive impact of strength-based and community thinking on health issues such as COVID-19 now. And so what we want to do is start sharing the story of the constellation and their specific years of experience in dealing with matters of healthcare. And what we would like to do as well then is share and reflect together on a couple of thought-provoking but important principles on public health, and allow you to discover the self-assessment approach, which is part of the facilitation process that the Constellation is using worldwide in many other domains, as not just limited to healthcare, but many other domains. And for that, I would like to start by sort of asking a couple of questions to people that have been founding people of the Constellation. And I would like to address to Jean-Louis and Marlou with a couple of questions, right? Now, Jean-Louis and Marlou, you were both involved in the public health management at the UNAIDS, United Nations AIDS department, and so on the HIV. So, and you learned apparently about some positive, effective approach that was locally applied in Thailand on the issue of HIV at the time. Now, could you briefly describe what this, so to say, uncommon approach was on the health management at the time? What did you discover in Thailand? Who would like to start on that? Marlou, yes.
Yes. I would like to start by bringing you all to that place. Here, to Tawang Tan, Thailand, 1996. It's in the north of Thailand. Beautiful, green and calm place, but also where HIV/AIDS hit. And yeah, I want to share our experience, but through the experience, the story of Kunteo, who lives in Tawang Tan. We had the privilege of going back to her last year with a couple of people and ask her about what she learned. She was she learned that she was infected through her husband, who passed away in 1996. She had one child. She has one child, a daughter. And yeah, she was deeply sad about it. So sad, actually, she wanted to finish her life. She couldn't bear the fact of carrying this disease with no hope for the future, and carrying the shame of having a disease with such a big taboo. So every day, again and again, she went to the health district office 7 days in a row, because she wanted to take her own life, but she wanted someone to take care of her child. And she spoke here with the man that you see, who was working at the health office. And he asked her just one question. He said, "Can anyone else be a better mother for your daughter?" And that question saved her life, saved her daughter's life, and saved the community maybe. Because through that question, she realized that I have strength. No one else than me can take care of my own daughter. So she rediscovered her strength. She was not a patient, she was not a victim. She had strength and could bring them to her own family. And she went further than that. And also thanks to this doctor who brought her to community meetings, let her talk. She spoke to big audiences, and she was an illiterate woman. The taboo was broken, and many other people could come out, could talk about what they were going through, what they were suffering, because they were infected, or their children were infected, or their neighbor were infected, and no one talked about it. So that community conversations could happen, and people could say, like, we have a problem, we are going to solve this. So people were going to sit around, we're looking, what can we do? What is our strength? And what can we not do? Where do we need help? Where do we need healthcare? Do we need condoms or information? But first of all, it came from them. They realized that there was a problem. It's our problem. We have our solutions, and we know what we don't have and what we need to ask for. So taboo was broken through Kunteo, but she's an example, just one of the examples that we know, but there were, of course, other people involved. When we went back last year, here you see, it's the same doctor sitting there. There is a district volunteer. There are people from monks. There's the mayor is there. So this was not one person, and it was not just citizens. This were all people from all sectors coming together as human beings. So now, what is it, 25 years later, that community is still standing strong and still together. So when we ask them, what did you learn? We learned that as a community response, the strength is important. The trust, not only in each other, but also that government has in us, that we can solve issues. We do it together and we talk about it. Those were the 4 core elements. And that's what we were very grateful to learn through Kunteo, but through many others as well.
Yeah. Okay. Jean-Louis, how did you experience?
So in 1995, I was in Thailand, And I was fortunate to live in northern Thailand. And northern Thailand has a particular story related to AIDS. I was seeing it from the point of view, sorry, of UNAIDS and of the United Nations Action on AIDS. And northern Thailand, something happened there, and in a particular province of Payao, the proportion of young men with HIV was going down. It went down from 20% of people, men aged 20 years old, 21 years old. The proportion was 20% in June 92 to 0 point something percent in 2000. And so the question was, what is happening there that is not happening elsewhere? Why is the proportion of people with HIV going down there while the epidemic is raging in the rest of the world? And if we see it from the point of view of the health authorities, the first thing they did was to, and we think about COVID now, the first thing they did in Thailand was to counter the UN campaigns that were based on fear. So they shifted the message to the population, in particular in northern Thailand, from this is very dangerous, look at those walking skeletons, this is called AIDS, to saying, look, sex is a beautiful thing, but some people here are at risk and they need to take some measures. That is the first thing. The second thing is the belief by the health authorities, by the political authorities. We believe in your response ability. You are able to respond. In the office of the Payao Health Office, where I worked for 3 years, half-time, there was a big poster. You don't change people. People change by themselves, and they practice that. So, and the third one is actually what Marlou was describing just before. The space was created for discussions to be had by the people, public discussions. Why are we in this mess? We see our kids coming back in coffins. This is not normal. What can we do about it? And they did it. So many measures were taken by the citizenry, by themselves, to actually change the situation. And I will just stop with that. So these were the elements that were basically at work there. I will stop there for the sake of time.
Yeah, so you both saw some different elements where actually the communities, the people became actors of their own health. And there was this relationship of which role is there to play by government, by other organizations, by the communities, by the individuals. So there is quite some difference noticeable as opposed to what we see now in other health crises around the world as well. So that's interesting, and that was the base that formed the basis. That discovery formed the basis of the constellation, which is now worldwide, a growing community of communities and facilitators that help to become more an actor of yourself. Which brings us to what we would like to have a small subgroup discussion about, if you wish. And we have 3 questions for each of your small groups to talk about. You can choose whether you are answering all 3 questions or just limit yourselves to 1 question. But what we would like to ask is 3 questions, and one question is, in what ways do you manifest yourself and others in your environment as being actors of health? In what ways do you manifest yourself and others as being an actor of health? The second question, what is holding people back from applying their actor strength on health matters, such as, for instance, COVID-19? And how can we facilitate the actor strengths to emerge, right? And the third question is, how can we evolve from I to we with regards to taking relevant precautions on COVID-19, for instance? So from I take care for myself to I take care for others to we take care together. So those are the three questions we would like you to have a chat about in your subgroup and in the breakout rooms on these 3 questions. So if you could assign somebody to give feedback after the breakout session, you will be called back, or automatically, I guess, after, I think it's 15 minutes you have in your group for a group discussion on these 3 questions. And then after 15 minutes, we would like to ask for your feedback from your subgroup session. Is that okay for everybody? Then I'm going to ask Marlu to be so kind to bring people in subgroups.
Yeah, groups of 3. And the questions are also copied now in the group chat, and I will share them through the broadcast as well. So you will have them. Enjoy. There you go.
What came out of the discussions? And then it took a bit, right? Which group wants to start first with giving some feedback on what came out of the discussion on the 1 or 3 questions?
Yeah, can we go?
Yes, Manorama, yes,
Yeah.
please,
Yeah.
go ahead.
Actually, our group decided that actor is someone who protects himself as well as the society and community as a whole. So the question first, we thought like the person has to take care of the protective measures, like wearing the proper, covering himself, wearing proper things like maintaining the social distancing. And along with that, we also decided that the actor is someone who will communicate the message. So someone who, whether it's me or someone from the group or as a community, how we can extend the message across. The message can be about protecting yourself, about maintaining the social distancing, about supporting those who are not there, like, for example, the communities, the societies, breaking those walls and creating the bridges so that we can reach out with support, with livelihoods, with food and for supplements for those people who are not doing that good, so that no one is left behind. That's number 1. Number 2, through this, like we have decided like this kind of action and awareness, like so that people will take some kind of, they can open up whatever they have the challenges, they have the problems. And for that, we have also thought of like as a group that we need to get everybody on the board. So how we can involve the communities and societies, like the NGOs. For example, we have thought of NGO as a very strong force which can reach out to the last, like even though the governments and all that, they are there, but NGO support is needed for this thing, both as awareness as well as reaching out their food and livelihoods and things to the people who are like maybe marginalized, maybe women, maybe HIV positive, maybe because HIV positive, they need the antiretroviral therapy, how we can ensure that during these kind of lockdowns and when the systems are not well, how they can get the antiretroviral therapy and so that they don't have those kind of breaks, how we can ensure that the migrants and all that, they have food, at least some kind of meals, how we can ensure that pregnant women that have NGO support, we thought that is very much needed in these kind of things. Then we have thought of like how we can, the third question, when we are saying that how can I or we evolve from how we can, we can evolve to we. So we have thought of that we need to break the geographical barriers, how we can break the geographical barriers by emerging out as leaders who will set the, right kind of course, right kind of decisions, right kind of like have community support systems wherein like today I'm talking to n number of people across the globe. So these kind of platforms can be created wherein we can exchange the good practices and those kind of things so that geographical barriers are broken, and the best practices we can look into, like how the best practices maybe from France, we can replicate it in India for something, what's good in India, we can replicate in USA, and how we can support, garner that kind of community mobilization support and strengthen each other. So, and number third, we also thought of like reaching out when it comes to the evidence and research as a group, how we can supplement each other's research, how we can as a countries, as a community support that kind of thing also. So this is what we thought as a group. And then I have my two new members who have been quite generous in giving me voice to speak here. Lucy B and Sina, they have been quite this thing, they can add on in case I missed something.
They say it's that you did a good job. Yes, yes. If the way it came into me, it was like you were like what it is to be an actor, like giving an example, giving and ensuring communication and inclusion. Inclusion is the word that came out when you were talking about your and how to involve all the forces. That to me was coming out, and breaking the barriers. For me, when you were speaking about geographical barriers, I thought, well, is it just geographical barriers? I think there's so many barriers that you have mentioned by naming the different groups. So maybe it's about how can we make the barriers clear? What are the barriers? And how can we make sure that they go away? Yeah. So thank you very much from this group and the other group. Can they perhaps share what they have discussed and found from the discussion, please? Harriet, maybe can you unmute? Or?
Yeah, I thought I find the word actor a bit challenging because I don't know if it's because I worked in a creative organisation, so actors to me appear on stage, and it makes it hard for me to imagine them as people. Maybe I don't know.
Life is a stage, isn't it?
Yeah, maybe Keys would be better explaining it than I would, but I think we unfortunately, we can see Leonard now. Hi, Leonard. But he had trouble with his computer, so we did some of our conversation in the chat. But I think we reflected on how people prioritised their health maybe for the first time, or Keys felt really confident in his government and how that made it easy to be an individual and make a decision on your health and to follow instructions. Whereas I felt my government didn't act quick enough. So we looked at the global response and what other individuals were doing, and made some personal decisions on that in line with what other people were doing. Leonard sort of came in with explaining how, and I think reading between the lines, Leonard and I felt the same, that people were not held back as individuals. They recognise their strengths in their communities, and in our communities we've responded, and our community response has been our strength and has supported one another and perhaps fixed problems that our governments have left empty because they've not been able to respond on a local level. Leonard's example was how people weren't getting meals in his community, and the residents have come together and made sure people are fed. And my example was the NHS, who's our National Health Service in the UK, responded by saying we want lots of volunteers, but what they didn't think about was on a local level people were already volunteering and supporting, so the national level overlooked what was happening on the ground and how people were working together already. So we kind of, I think, I might be wrong, but we kind of felt that we were already using our strengths as individuals to respond to COVID in a collective way. Please correct me if I'm wrong, Keys, Leonard, because your understanding of the questions was better than mine.
Perfectly right, Harriet. Thank you very much. Yeah, we were confident in Holland. I think as a community, Dutch community, we were confident in the government, and we all lacked knowledge, you know, to do otherwise. So we just stick to rules and regulations until 8 weeks. I couldn't visit my parents, and we were all taking care of the elderly. But in the end, the elderly were in prison, you know, in these care homes. How do you call that? Nursing homes. So that's about after 3 months now we are revolting a little bit. But also the government is responding to that very positively, I think, based on scientific knowledge, you know. I think they're really doing a good job. So makes me proud of my government, to be honest, and also to the community in Holland. But now we're on the time, you know, to really unlock, you know, the lockdown. So yesterday we're now having new discussions about Black Lives Matters, you know. It's more actual actually than the Corona crisis at the moment in Holland. So now we use our time. I use my time to make intercultural relations, you know, through Zoom, through internet. So we organized some video sessions with the people on Saparua, and we connected them to students in Deventer, which is a town in Holland, the university in Holland. And we found out very interesting things that's happening, you know, in between cultures, in between really understanding each other's context, you know, really understanding.
I think if I may, it's also about actorship of creating this society of inclusion and taking away the barriers which were created in the ancient times, and some people still use those barriers. But I mean, there is a number of principles that we can look at the issue as where you say the topic of the Black Lives Matters. There's many similarities on how to go about progressing, and I very much enjoyed Harriet when you referred to it's about we are already acting, we are already actors, and I was also triggered by the fact that you said we as a person or a community, we were trying to get information to have a more open view rather than just what the government was telling us. So becoming informed as part of becoming an actor is becoming informed about what is going on. And I was also intrigued by your remark of the national level that seemed to be unaware of local actions that are already being taken. And so that is a matter that is coming more than once back. Now, perhaps Jean-Louis, can I ask you to explain to us or tell us about the three principles of the strength-based approach to COVID-19. Where you say about the difference between probability of contagion versus the risk of severe illness. Yes.
I'm confused. In the flow, wasn't there a little movie to be shown? Is that afterwards, Marlou?
It's afterwards. It's first you.
Okay, okay.
Yeah.
So yes, if we hear, well, a few things about my own village here and Belgium. As you know, Belgium has been hit very seriously. We have quite very high levels of death rates for COVID or associated to COVID. Part of the reasons is that we count every single death, including those in nursing homes, which other countries don't necessarily do. There was a lockdown that was quite serious. And the question is, how do we get out of that lockdown? If you have your house on fire, it is quite normal that you are taken out of your home. The police says you don't go in, and you obey. You don't. There is an emergency. You cannot go in. You don't go in. But the day comes where you have to rebuild your house. Then you don't ask the police, how should I rebuild my house? You take charge of rebuilding your house. And there is a feeling shared with, for instance, Germany and also with the Netherlands, probably also in the UK. Mariette can say, and others can say, people are upset because we have experiences of protocols, and this is what you do in schools, and this is what you do here and there. And people start moving away, not listening anymore, not listening to the news, not listening to anything, and doing their thing. This is maybe dangerous. Maybe it's good, maybe it's dangerous. So taking our cues from what we have learned in the constellation, with the stories we told at the outset on AIDS, believing in the people's capacity to act by themselves, to believing in their responsibility, without, and learning also from AIDS, but also Ebola or H1N1, we say, well, the first thing is a matter of understanding. The matter of understanding is that basically the probability of infection is not the same as the risk of having a severe disease. In my country, maximum 1/4 of the population is at risk of developing severe disease and dying from it. These are the people aged more than 65 and those with diabetes, with obesity, or with severe lung infection or affection of disease. So these are the people who are at risk. So, but it seems that all the communication, and that is instilling fear in people, every single infection seems to be very dangerous, which is not the case. Infections at school will not bring kids any harm. So this distinction between risk and probability of infection, in our view, needs to be made. it is regular public health practice to do that. For instance, if you take the regular flu, the influenza, people of old age are recommended to take the vaccine. Not kids at school, but kids at school will also do influenza, but they are not immunized. Women age 18 are not recommended to send for a mammogram because they are not at risk of acquiring cancer. That risk of cancer is with women older age. So the first thing we think is to explain that to the population. Once we do that, we can then propose 3 principles that are based on strength. The first one is the person at risk is the main actor when it comes to prevention. It is for those people that extra measures such as, and we don't call it social distancing, but physical distancing and wearing masks are important. The second point is solidarity is a key element. So there is no grandfather that I know of, I'm one, that would wish to keep the children from school just to protect me or to protect us. We want our grandchildren to have a proper education, and that includes going to school, no, in a normal fashion. There is also no grandparents who will say, oh, don't have any celebration after recess. Why? Those young people have been under lockdown. They also deserve a break. So this is from the point of view of the people who have a risk of dying of COVID. From the point of view of those who are not at risk, there is a request that is in those settings where you, by necessity, meet people who are at risk, please take some particular measures, which is wear a mask and observe social distancing. What are those settings? Well, these are the settings where it is now absolutely clear that the probability of contagion is much higher, which are hospitals, nursing homes, probably markets and places, confined places where there are many people. These are places where, when out of necessity, people at risk have to go, there is a need for everyone to wear a mask. So this is number 2. Number 3 is in every setting where there are identifiable people at risk, such as families, neighborhoods, places of work, for God's sake, talk. The conversation is important so that you can balance your individual risks with the quality of your lives. And therefore, there is basically no damn reason for a person dying like my auntie, who was 99 years old when she died, to die alone. As Kees was saying, it is very clear that there is no risk for anyone to acquire COVID at that time, certainly not her, nor the people who are next if they take basic measures of protection. So these are the 3 principles upon which we built something called a self-assessment, and we called it co-check. That co-check, out of necessity, because we were confined and we still are to some extent, we cannot in Belgium hold a meeting, an open meeting, we still cannot do that. So we are doing this through the internet, and it is available on mobile phone and on the computer. So this is the introduction.
Okay, anybody has any questions so far on it? I can give you opportunity. It's all clear? Yes. Okay. So how long have you been Zooming today? Like 1 hour, 2 hours, 3 hours, 4 hours, 5 hours? How much time have you been stuck to your screen now? 6 hours, 5 hours, 3 hours, 4 hours, 4 hours, 2 hours? Okay, I guess this is time for a physical break. And what I would like to introduce to you is what we call the CLCP clap. CLCP clap is what you do normally is you stand on your feet. If you want, you can sit, you can do it while sitting as well, but you can stand up as well, right? So what we do is we are going to warm up our hands, right? And so we warm up down below. We do it below. We do it below. We do it below. We do it below. Okay. And then we go up and then we rise up and we warm our hands. Okay. And then we go to the left. And then we go to the right. And then we give the CLCP clap as an appreciation for all the people of organizing this conference, this unconference, and all the health workers around the world, and all the people with good intentions. So what we do is we do 1, 2, 3, 1, 2, 3, 1, 2, 3, and then we throw the appreciation in the air. Okay, so are we ready for this? So we go 1, 2, 3, you! The appreciation goes around the world. Okay, thank you very much. Ladies and gentlemen, it's time for a movie. Marlou,
Yes,
show us the
popcorn
movie
time.
on the co-check, please. Thank you.
Yes. Yeah, almost. Share screen. Share. And now this is in the way.
Well, I have a wonderful electronic invention I want you to see. See? It looks something like.
Imagine a future where COVID-19 is a manageable illness just like any other, where we can get together with friends, hug our loved ones, and attend interesting events without any fear. It's a beautiful thought, isn't it? But what will it take? How do we know if we're doing enough? For me, I use the co-check. Co-check is an online tool that helps guide a reflection about how we can prevent the spread of the virus. It lists a number of simple practices, and for each practice, we can reflect, score ourselves, and develop ideas on how we can improve. What I love about the co-check is it's not the scores that really matter. No one's checking them. It's the very process of reflection and discussion that allows people to take an inward look at their own behavior. From there, we can take action and make the changes that we need to make. From Asia to Europe, to the US to Africa, individuals, families, and groups are working together to develop their own unique responses to COVID-19. As You Open Your Eyes is proud to present their stories in a film series called Behind the Mask. Let's get inspired by their stories and find our own unique responses to this situation. We can change this situation. Behind our masks, we're all just ordinary people, but with extraordinary power.
So stop sharing here. So this movie introduces the co-check. So the co-check that we will talk further about during the remainder of this session. It's also an introduction to a series of small movie clips that people made by themselves, about the measures that they take to create the social immunity. And those are measures which are also related to the practices in the co-check. But to understand better what practices is, what co-check is, I'll ask Jean-Louis to explain that as a process.
Okay, I will try to do that. For that, I will share my screen, and I'm just in the process of doing this. But I see that the link is quite, the bandwidth is quite, there we are. Sorry, present. And I now will share my screen. Are you okay? Are you seeing this screen? Someone? Yes. I see nodding faces. And so the basic attitude that we are using in the constellation was born out of that experience in northern Thailand. And we said, well, if we have to stimulate community responses to AIDS in places where there is still fear and people just waiting for experts, what can we do? And we said we'll come as human beings to learn from the experience of other people. And so we will listen. We will make sure they realize their own strengths. That will stimulate their own ability and also ours. This will transform the community, but also ourselves. And that transformation will spread around the world. So Constellation was created with the dream to stimulate and connect local responses to AIDS worldwide. 6 months later, it was already dealing with, we were invited, later, that is 2005, we were invited by others to address other health and life challenges. And now here is COVID. So, Huh. So I'm sorry, because my screen is going. So this is then the process that we accompany. The first step is, who are we? In other words, this group here, who are we as human beings? No titles, nothing. Who am I as a human being? What are the strengths I have? And the next step is, what is my dream? And from that dream, there is in the number 3 there, practices. In other words, how shall we as a group, or me as an individual, reach the dream? Through which set of practices will I progress towards I or us, to our ability to respond to the challenge? In this case, we are talking about the challenge of responding to COVID. So not just adhering to instructions from government, but from within, from our own strengths. What shall we do? So I already gave those principles. The first thing is, we started from a strategy that is based on risks, where we try to balance the cost of an intervention with its benefit. act out of solidarity, because this is how we are made of. We are made out of solidarity. The idea that we are individuals looking for just our self-interest is just totally wrong from a scientific point of view. We act deep in ourselves, we act out of solidarity. And the third principle is that communities care. So in communities, whether families, neighborhoods, or places of work or worship, we can care for each other. So from that standpoint, we then went to think about what can happen in various places if we take responsibility. And this is then a proposal to actually, with the measures on the right and the various probabilities of infection on the top. You will see then, and I will not go to the details, that would bring me way too far, but this is then the various attitudes and practices we can take, from the basic practices of sneezing into the fold of your arm, trying not to touch one's face, trying to wash hands, greeting each other at a distance. This is what everyone can do. Mask and physical distancing, we need to do out of care of people at risk in specific settings where they are there and we are caring for each other. That is the fundamental idea behind this code check. Now, these are then the practices. These are the things I can do as an individual to make sure that I care for myself, I care for others, and voila, here are 13 practices that we propose. Those practices have come from a process of consultation that, because the Constellation is a worldwide organization, we had several discussions around those practices. This is what we came up with on the basis of an earlier code check that was more general, but on the basis of the fact that we now are in the process of getting out of lockdown, we propose this as a means to check whether we individually, but ideally in groups, we can discuss, I wash my hands before a meal, etc. Let me take number 4, I touch my face until I've washed my hands. I know, for instance, that alone, I cannot get there. I need my wife to remind me that I'm touching my face a lot. My wife will tell me that, or a friend will tell me that. We can therefore have conversations in our concrete settings on the basis of those practices. Now, I'm not given a lot of time. I know that there will be an exercise just after. So bear with me. I will go to the next place. But all those practices that you are there stem from the general framework that is presented in the slide just before. Now, for any of those, we have then a grid. In other words, let me, for instance, take the question for me. I touch my face only after washing my hands. Then I have to, I give myself a level from 1 to 5. 1 is, I just know I need to do something, but there is not more than that. 2 is, I know how to do this, but I don't do it. 3, I can give examples where I became conscious that I was touching my face, but it's only once in a while. 4 is we act systematically. In other words, I make a conscious effort, but it takes an effort to avoid touching my face, except when after I wash my hands. And 5, I'm becoming aware that I'm touching my face without immediately. So I'm very much aware. And so if I'm not doing it, then I say, oh, something is wrong here. So this is the scale we are offering for the co-check. The earlier co-check, 1,000 co-checks, 1,300 co-checks were done worldwide, most of them in Belgium, because that's where we promoted it. So I think I will just stop there. Over to you.
Yeah, to me, I think.
Yes.
Yeah.
Yes.
Yeah, Jean-Louis, so you have to stop sharing your screen.
Yes, and that little round saying busy is doing it for us. Hopefully, you'll get rid of my screen pretty soon. But it is taking a long time. So
yeah.
I'm sorry about that. I don't know what I can.
Meanwhile, a question from Manorama, and I can confirm Manorama is asking if we can get the PowerPoint. So yes, we will.
Yes,
make
of
sure
course. Of course,
we will share.
And I
what
can
is the
also
best
say
way?
link to the film
I
that
will
you
put
showed.
the link. Sorry,
It will happen. No worries. We with all the participants, that is foreseen also by the organizers. That yeah. So
I need to go. I will stop the Zoom and go back because I cannot get out of the screen. So I will stop.
We are out of your screen already.
You're out of.
Yeah,
I'm just not.
now.
Okay. Very good.
Yeah.
Thank you.
Yeah.
Oh, I am not out of his screen. I still have the Jean-Louis screen on my computer.
My screen probably. Do you see now?
I see the PowerPoint at the moment.
But with what? What do you see? But it's written
with various level 1 to 5. The last slide.
I will disappear from this because
don't disappear.
Maybe stop sharing your.
Strange, yeah, because for me it looked as if I was sharing. So learning every day. Yeah.
The wonder world of Zoom.
Continue. Yeah, it may have to do with the fact that, okay, no worries. I will try because now I have to share my screen. And is that done now? Do you see?
It's still on.
No, it is there. We have 23, 24, 25 slides coming, and we have few pics coming. That's it. Chair, we can't see. Chair has gone somewhere.
Strange. Well, then we do without any PowerPoint.
Maybe we can choose multiple participants can share simultaneously, and that might.
Wait, I can. Maybe I can open.
I have a choice. I have a choice.
Now there is a change. There is a change.
Jean-Louis or
We are back.
Okay.
Yeah, we are back at the normal screen.
I have eliminated Jean-Louis. Yeah. So
now you can share your screen, Marlou.
Yeah.
Super.
So. This one, do you see it? Co-check.
Yeah.
Loud and clear.
Yes. So that was the theory that Jean-Louis saw the background about the step of self-assessment. So the step where people look and discuss for themselves how well they are doing on certain practices. And in this case, in the case of co-check, the practices that are relevant to keep safe and protect the vulnerable from COVID-19. I always insist that the conversation, when we do a self-assessment, the conversation is so important. And even if it's difficult when in times of physical distancing, I think whatever we can do to make a conversation possible is important, because together we learn more. We can think that some things we are already doing good, but then when we hear others talking about what they are doing, we get new ideas and we can improve. And that is the whole idea, that we all improve our practices. So for the next about 10 minutes, I will just, as an exercise, take you through a few of the practices that Jean-Louis had shared as an exercise, and to test if that conversation could work for us, even if we don't know each other, but if we cannot check each other, but can the conversation help? So I chose the practice that is there. I wash my hands after having been out. And the question in the self-assessment would be, first, to all of us, how good are we doing with that? The number one being, we know that we need to act. Number two, we know how to act, but we do not. Number three, we act sporadically. Number four, we act systematically. Or five, this is just natural. I do this all the time and I feel very bad if I don't. And you may all in the chat box score yourself from 1 to 5 on I wash my hands after having been out. So what would be your score? I see Jan is at level 4. Who has more? Luc has a 3. Tinyun as well. Number 3 with a smile. Kees is at 3. Jean-Louis is at 3. Okay, Sina, how are you doing with regard to washing hands? Or maybe you are out washing your hands at the moment. Okay, so we have Jan. Jan, convince us. Why are you at level 4 with regard to washing hands every time when you have been out? What do you do?
Well, what do I do? What I did to make sure that it has become almost a natural habit is by talking to so many people about the process of washing hands, then it becomes at a conscious level. So I try, there is this old belief that I have about it takes 21 days to get a new habit. And so I'm very much aware of trying to hold on to a new habit for 21 days. And in most of the cases, there are some other habits, in most of the cases that actually works. So I'm in the process. I'm in the process of going towards 5. Yeah, every time we go out, it's and I also pick up the signals from, like I was talking to my dentist whom I met on the street, and she was talking about the actions that she has to take during her consultations on making sure that everything is clean and the risks. And then I spoke to a doctor I know who has also a dog like I have, and I met her somewhere on the street, and she was talking about all her practices that she has to do. So it's about constantly being aware, and that helps me to, oh yeah, okay, I've been out, yes.
So what do you, so you have been out, you come in, what do you do?
Well, what I do is before I enter the main part of the house, shall we say, I go to the toilet room where there is a washing basin, and I make sure that I wash my hands with soap. And before I go to dinner, I wash my hands with soap. And if I have to if I have to go out to a shop, I have this this disinfectant thing in the car, sort of like a hand gel, or how do you call it in English? So I every time I see people disinfecting like shopping carts, and that reminds me of, like, okay, when I get in my car and I put my stuff in my car, I sit in my car, I take this hand gel and I just clean my hands. It's
There are several people at number 3. So Luc, you said number 3, to be completely honest. What makes it difficult?
Oh, the systematicity. This is, I do it sometimes, and I forget also sometimes. So this is, I don't have a tip to remind me. So in some instances, when I come back to home, then I wash it because and it's also because I'm thinking about something else, I forget, and then go ahead. That's it. So I think I know I have to do it, but I still forget. So
Yes,
it's like,
as someone
like Jean-Louis about touching his face. That's the same thing. I mean, I know I have to improve. I know I have to do it systematically. I have all the necessary material. I have hydroalcoholic gels everywhere, but it doesn't work. I mean, it doesn't work. It's
not
it's
at
a
level
constant.
4.
It's a constant concern.
Yeah. Does anyone in this group have a tip for what can we do to remind ourselves? Maybe from other things that we needed to be reminded of. How can we all remind ourselves?
If I may, you could sort of on the 21 days rule, you could say every day I do for myself a check as to, okay, how was my practice today? Or in the morning, how was my practice yesterday about this? And okay, how am I going to do it today? And just to make sure that it's now the 7th or it's the 15th or the 17th day. Yeah.
Yeah. Okay.
To be frank, it has been 3 months. I'm starting the idea of 21 days. So every time I fail, I have to start again. So it's a bit cumbersome.
Yeah, but at least taking the conscious time to reflect on how we did. That is the tip of Jan. Okay.
I think you can also add it to your calendar in Word. The moment you will have the calendar in front of what are your meetings or your chores today, and if it's put in your calendar, you'll automatically see it like whenever you are having any meeting, one word like
wash your hand.
Hand wash, simple. 2 words.
Shall we?
Shall we? Yes. Your microphone, Jean-Louis.
Sorry, that's also one where you, Marlou, you're right in insisting let's do it together if we can. Because, for instance, let's say workplace, well, maybe there is a basin at the entrance. So, I will do it. And then we are also helping each other, reminding ourselves that we need to do it. So it's the same with washing one's hands in workshops, etc. I know that it is, in fact, a nightmare unless there is a washing basin next, like in many settings in India, it is automatic. In our culture, we don't. Basically, we go straight to the buffet and we eat. So that's where this collective conversation and taking measures as a collective is very important every time we can do it.
Yeah, and in the house,
I even asked my granddaughter to remind me. And when she was taught in school how to wash hands, they have to do this for so many seconds. So they combine learning to count the figures 1, 2, 3, 4, 5 up to I think it's 24. She has to do it, and it's a way of play. It's the playfulness helps as well.
Yeah. And then when you talk about it in your household, you can remind each other like, okay, let's take a clean towel every now and then. Who is in charge of keeping the towels clean and having the soap filled? So this conversation as an example of how you can get new ideas, but also how you can mobilize the people around you to together stay safe or take the measures that will help us all to do better. Time-wise, I think we can do no other. Unfortunately, I really wanted to do the one for families, but leave that up to you.
Yes, that is time. Time is important in these cases.
Yeah. But may I suggest you all, if you like this exercise, look at the code check, look at it for yourself, but try to have a conversation like we just had with whoever is near to you.
And if I may just add, is like when the experience I've had with the self-assessment, both in business environments, in communities, organizations, and even in individual cases where I, as a coach, help people to progress on different aspects, is what always helps as well is like if you are on level 3, is the question, what will need to change to bring you from 3 to 4?
Yeah.
It's not about you're now on 2, how can you get to 5? No, it's about you're on 2. Okay, what can help? What is the small thing that needs to change or that has to come to bring you from 2 to 3? So that also can help very much. Okay, so now we are at this time 17:50, and it's a perfect on time on our schedule to ask the golden question. And it's not the golden question that you might be used to as a coach, but the golden question is, what did we learn today? What did you pick up from this session? Is there some dust of gold that you picked up from this session? And don't worry, we're not going to charge you for the gold. Is there some interesting elements you picked up today? But you have to unmute, of course, if you want to share with us what this session brought to you.
Hi.
Yes, Jun.
I really appreciate the tools you guys shared with us. I really appreciate that you guys have created this framework called Code Check as a format for people to interact with each other. I think having a framework like this, having like some of you guys mentioned before, having a clear instructions always help community to mobilize. That's something I didn't think of before. I thought, okay, how can I reach this cloud called community mobilization? And I think it could boil down to like how one person can interact with another person in a way that is supportive, and you can actually point out what is the goal you want to reach.
Yes, that's the essential part as well, is to how to make sure that there is a collective dream being created. If you want to go on holiday with your kids, for instance, with your children, what you do to motivate them to go to this place somewhere far away is to create this collective idea, vision of where are we going to? That's the collective dream. And then to get there, you have to practice this. And yeah, it's a very useful framework. I can tell from my experience. Manorama.
Can I use it in my paper?
Say again?
Can I use it in my paper?
Yeah.
Thank you.
Of course. You can even make reference to the book of Jean-Louis Lambouré, What Makes Us Human.
I will.
It's a recommended, highly recommended reading, by the way.
Cool.
Manorama, with the beautiful name.
Yeah. I found it very useful, even though like we know like how much important the conversation is, how much community involvement is important, and the way you mentioned it about the SALT and 1 to 5. 1 to 5 I found very useful. At the same time, I found the SALT, what we said, even though like we have been continuously knowing it, but doing it is altogether different. And it was like recapitulating and that how important this is. That was one thing I liked about it. And overall, like knowing each other and as communities, like conversing with each other, I think that is one of the very important things. Inclusion, very important thing that has come out of this overall meeting, which I find is very, very useful as a, a social sector development professional. And at the same time, what you said, like how you can remember these kind of things, that you have to wash your hands and all that, that I also found very useful. Because in Indian civilization, like it was a culture actually to wash the hands before this thing. When we were kids, we were not being served food unless and until we wash our hands with soap in children, or we could not enter the kitchen. Even the head or lady, house lady, could never enter the kitchen unless until she had to wash her hands before touching everything. Because the Indians, like they take food by hand normally, mostly. Nowadays we have changed it, like our generations
which makes
have
the
changed.
food extra, which makes the food extra nicer.
So now we had forgotten, our generation had forgotten, like we had become like, okay, we'll use spoon and fork and that's it, like. But now again we are going to those age old, earlier what our fathers, grandfathers, mothers taught us, like you have to wash your hands, like going to temple, going to any place, we had to wash our hands. So automatically, like 10-15 times we used to wash hands in a day. That was like whether you are going out, when you would enter the home, then also they would never enter. You have to take a bath. That was must, like. So, but over a period of time, we felt that we had forgotten these kind of things. And this COVID has actually made us realize like where we were heading. And now again, we are trying to follow that and remembering those things, like, yeah, this was something very useful, which we had left back.
So it's a cultural strength of India.
Yeah.
Go.
So look, if I may do a suggestion to get your hand washing cleaning is stop eating with knife and fork and start eating only with your hands. It will help.
At least for after eating.
Well,
that's a good idea. That's a good idea, and it will save water for the washing. At least of the forks and the spoons and the knife.
Yes. Okay. Look, did you take something from this session? It was great to have you and to see you around. But obviously you are very familiar with the constellation.
Yeah, exactly. So it was nice to discuss with people. I mean, what I get every time I discuss with the group is it strengthens the relevance of the approach of what we are doing. So sometimes we need that to keep the direction, if I can say.
Yes.
To remind ourselves.
To remind ourselves that we are fully relevant. So I don't. Besides that, maybe I can apply. I can put a bathing with soap in front of on a small table when entering the flat.
Why not?
I don't have a lot of room there, but
be creative. Be creative.
Yeah.
Then there is a tip from Amsterdam, because you live in an apartment building. In Amsterdam, the group has put a basin at the entrance of the apartment building so that not everyone touches the elevator or the stairway.
The doorbells and the...
So if you're going to create basin, do it downstairs.
We don't have elevators. We don't have elevator here, but at least if I can put a table outside of my flat, that would be already something.
Something, yeah.
Okay.
And it will show
others so Tinjun, you want to say something, Tinjun?
Yes, one quick question. It's just something I thought of. Like when we're doing co-check, I can imagine that if we're to ask something that might be sensitive to some people, there might be a social desirability bias where they might produce an answer they think is more socially acceptable. How do we get around that and support?
What if I can share from my experience, Jean-Louis, if it's okay? What I do when I do this in sessions on topics such as burnout and all these, I ask people in the group to say, what is your score But to be honest, it doesn't matter what you show. It's important for yourself. If it's an important topic, it's important between your ears that you have your score correct, and that you are becoming aware of what am I doing and what are my potentials. So that is very important. The expressing in the group, that is when there is trust, and when they feel there is no taboo about discussing the topic. But before that, it's important that you have your proper score. That's Jean-Louis, but perhaps you have some other answers on the question.
No, that's the whole point. I have nothing to add to that. Only on the online code check, and it is just being rebuilt. So you can take a look. I'll put it there, but please understand it's code check 2.0 is coming out over the weekend. So if you wait until next weekend, you will have the practices that you have seen now.
Yeah.
And we say, please, there is no, this is an individual, and there is no individual record being held. There is no individual record. There is also the, let's say, the IP and all that is not taken. The only thing that is taken is the zip code, so that in my own village, I know what are the practices that are still challenging to the citizen of my village. And through that, we can then also accompany them in the evolution. For instance, wearing masks properly is still a challenge in my community, very clearly. People pretend they wash their hands, but I'm still very skeptical about it. So this idea that there is some, no, I cannot write down here that I'm not washing my hands, is definitely something that is at work. But at the same time, what's important is what's happening in the head, as Jan was saying.
Sorry for having to interrupt this expose, but we have come to our dedicated time that we were allowed to use to have this wonderful interaction with you. And on behalf of the Constellation and on behalf of the organizers, I would like to thank you from the deepest of my heart for your participation. And I hope you very much enjoyed it, and take good care. And don't forget, wash your hands.